Hi, I'm Casey Albin from the Albin Insurance Group, the family business behind Medicare, Medicare.com. Today, we'll explore everything that you need to know about enrolling in Medicare for the very first time. We'll walk through parts A, B, C, and D, and we'll explore the coverage gaps. I'll share 3 strategies that people follow to make their Medicare enrollment successful. We're going to go over the Medicare enrollment guidelines, including penalties and deadlines. We'll talk about supplemental options and drug plans, and then my 2 steps to making Medicare easy for everyone. Medicare is a national health insurance plan covering people age 65 and older, as well as some younger folks. It's divided into 2 parts, A and B. Part A is considered hospital insurance. That covers all your inpatient care, basically everything except doctor costs. Part B is medical service. That covers doctors, both inpatient and outpatient, labs, blood testing, x-rays, MRIs, durable medical equipment, etc. Medicare Part A is zero cost for 99.9% of beneficiaries. Medicare Part B, on the other hand, has a premium of $185 per month in 2025. That's deducted from your Social Security check, and if you're not collecting yet, they'll bill you quarterly. Now let's look at some of the items that are not covered by Medicare, such as dental care, vision, cosmetic surgery, alternative medicine, hearing aids, care received outside of the USA, non-emergency transportation, and custodial convalescent care. Original Medicare covers a lot, but it still leaves some gaps under both Parts A and B that you're responsible for. Under Part A, you're responsible for a deductible of $1,676 if you go in the hospital, and some additional costs if you're in there more than 60 days. After 150 days, Medicare does not pay for your hospital coverage. There's also a copay for skilled nursing care if you're in a facility for more than 20 days. And finally, if you get blood in the hospital, you'll pay for the first 3 pints, typically somewhere between $200 and $300 per pint. Under Part B, you're going to pay an annual deductible of $257. After that, Medicare pays for 80% of the covered expenses, which means you pay 20%. There's no cap on the 80% that Medicare pays, which is great. But that also means that there's no cap on the 20% that you're responsible for. That can add up pretty quickly if you have a significant claim. Now that you know what Medicare covers and what it doesn't, let's look at the ways to enroll in Medicare. If you're already collecting Social Security, your enrollment in Parts A and B is automatic at age 65. If you're not collecting Social Security, you'll want to enroll up to 3 months prior to your birthday month. If you're planning on working past 65 and your employer is still providing group coverage, don't enroll. You can always enroll when you get ready to retire. When you're ready, visit your Social Security office or go to ssa.gov. What are the 3 ways people use Medicare? The first is to use Medicare by itself, subject to the gaps in coverage. The second is enrolling in what's known as a Medicare Advantage plan. The third way is to stay in Original Medicare and pair Original Medicare with a Medicare supplement, or what's commonly called a Medigap plan. Medicare Advantage plans are private managed care plans. They consist of different plans like HMOs and PPOs. The provider gets an annual payment to take you out of Medicare and provide your health benefits. The Part A and B gap structure is replaced with a private plan. These plans are considered inclusive plans because they also include drug coverage. With a Medicare Advantage plan, Medicare is essentially outsourcing your coverage. The insurer provides the coverage, not Medicare. If you're covered by a Medicare Advantage plan, your red, white, and blue Medicare card is not used. Instead, you're going to present your plan's Medicare Advantage card. These plans are characterized by networks of doctors and hospitals that you're permitted to see. They also have copays each time you go to the doctor, although some plans will waive it if you go to your primary care. They have co-insurance, which is when you pay a percentage of the service, usually 20% in the network, and as much as 50% for some things outside of the network. In many cases, you're going to need to ask your primary care for a referral in order to be able to see a specialist or another provider. These plans also use a cost management strategy known as pre-approval for services. This means that your doctor has to request approval from the insurance company and get permission before they can schedule your test or procedure, often adding administrative delays when time is of the essence. Medicare Advantage plans are very popular because many plans have low to zero premiums, and they typically offer some extra benefits like dental, vision, silver sneakers, and flex cards. Zero premium does not mean zero cost, and with maximum out-of-pocket limits for most PPO plans approaching $7,000 in 2025 and higher out-of-network, all of those co-payments and co-insurance can really add up quickly if you have a serious medical claim. Medicare supplement plans, also known as Medigap plans, are supplemental policies that simply fill the gaps left open by Parts A and B. Medicare supplement plans work with Original Medicare, and together they can provide you with up to 100% coverage for all of your Part A and Part B Medicare expenses. With no networks, referrals, or pre-approvals for services, you'll have access to the best care possible because you can see any doctor or go to any hospital anywhere in the country that takes Medicare. The plan must pay if Medicare pays. They are guaranteed renewable if premiums are paid. With benefits that can never change, the set premium of a Medicare supplement plan offers predictable costs when you're in retirement and on a fixed income, a time in your life where you can least afford thousands of dollars in surprise medical bills. With Medicare Supplement Plan, Medicare is your primary insurance, so you'll show your red, white, and blue Medicare card, you'll show your Medicare Supplement card, and between the two, you're just about 100% covered. Medicare Part D is for prescription drug coverage. Part D was added to Medicare in 2003. Prescription plans consist of a monthly premium, an annual deductible, and copays. The plans change yearly. Different plans have different drug formularies or lists of drugs that they cover, and the costs and copays for the same brands and drugs can vary. With your drug plan, you'll pay 100% of the drug costs before you reach the deductible, currently $590 on most plans. Once you reach that amount, the plan begins to pay its portion and you pay your copay until you reach the maximum out-of-pocket limit of $2,000. How do you figure out the right drug plan? The solution is Medicare.gov. This allows your plan choice to be prescription-driven. Simply enter your zip code, your medications, and follow the prompts. You can compare total costs and premiums across different plans, pharmacies, etc. It's a good idea to review it annually because the plans can change, and so can the prescriptions that you take. Now let's look at an apples-to-apples comparison between Medicare Advantage and Medicare Supplement plans. Medicare Advantage plans are managed care plans. They are characterized by networks of doctors and hospitals that you're allowed to use. This means you'll need referrals, and it will require pre-approvals for most services. These plans are characterized by lower premiums and much higher back-end costs in the form of copays and coinsurance. Medicare Supplement plans will charge a premium, but that virtually eliminates the back-end costs when you go to use the plan. In addition, you have complete freedom of choice because there's no networks and you can see any doctor or go to any hospital anywhere in the country where Medicare is accepted. Let's recap what we learned. Parts A and B make up Original Medicare. Part C is Medicare Advantage. These are HMO PPO plans, also known as managed care. Part D is prescription drug plans, and then Medicare Supplement plans are private supplemental plans that cover the gaps in Parts A and B, giving you access to the best care available. Medicare Supplement Plan G is the most comprehensive. After the annual deductible, it covers 100% of the Part A and Part B gap. Plan N offers a premium typically 25% lower than that of Plan G in exchange for paying some small copays and excluding coverage for excess charges. High deductible Plan G works just like traditional G, except that it has a deductible of $2,870 next year. A Medicare advisor can review these plans in detail and see which one might be right for you. Now let's look at 3 smart Medicare strategies that you can follow to make your enrollment successful. Step 1 is to start planning early. Don't act based on TV, radio, or internet ads because you'll receive a lot less than the full story. Instead, work with an independent licensed Medicare advisor who can provide you with unbiased answers and guidance. Now let's look at my 2 simple steps for making enrolling in Medicare easy. Step 1 is to make sure that you learn all that you can about Medicare Basics, Medicare Supplements, Medicare Advantage, Part D, and the late enrollment penalties, the enrollment periods for Medicare, Deadlines, penalties, guaranteed issue rights. It seems overwhelming, doesn't it? There's an awful lot to learn, and that's why I created Step 2. You can simply skip Step 1 and call me. I'm an independent licensed Medicare advisor, which means I work for you and I have access to plans and coverages not available to captive agents. My services are free to you, and over the past 30 years, my family and I have had the privilege of helping thousands of other clients with their coverage choices. You can schedule an appointment right on my calendar or call me in the office. You can also email me as well as call me or text me on my cell phone. I look forward to helping you as you embark on your Medicare journey.